Hey, it's Chris with ROE Dental Laboratory, and we are discussing today the ultimate restorative protocols for full arch restorations. A lot of questions about where to start and how to get to the ultimate outcome, which is a great final restoration for your patient. Well, this book covers it all. This has different patient scenarios depending on how they walked into your office, and then it has all the different restorative processes you can choose, because there are a lot of them out there. Today specifically, we are going to be highlighting the RAPID Appliance. Now, what is a RAPID Appliance? It is a duplicate of what the patient's wearing in their mouth currently on fixed multi-units. So the RAPID Appliance is in conjunction with Chrome GuidedSMILE, our patented full arch stackable guided protocol. Again, the RAPID Appliance, you get it the day of surgery, and it is picked up, there's TEP cylinders picked up in this RAPID Appliance the day of surgery, and that's your verification jig, and really your bite remnants, the vertical as well, all in one. Now, of course, it needs to be picked up the day of surgery, indexed on Chrome GuidedSMILE in order for this to work. But patient has, again, they'll show up in your office, a duplicate of what they're wearing, and then we're going to kind of go through the steps. I do want to mention there are other stackable options out there that have a duplicate appliance you can pick up day of surgery. That will also work. This is still the same protocol, just with the patented Chrome GuidedSMILE. We call it the RAPID Appliance. Again, it's a duplicate. All right, so now the patient comes back to your office and they're ready to transition into their printed try-on and then ultimately the final. You're going to have that RAPID Appliance in your office, whether you did the surgery or there was a specialist that did it and then they handed it over to you. You have this RAPID Appliance saved in your office, the duplicate of what the patient's been wearing. So now the patient there's a couple different ways to do this. I'll give you the best option here. But again, it's all laid out in this book for you, so you don't have to remember all this or frantically write everything down. But the patient is wearing their immediate load. Now that bite, you've been working on that for 4 to 6 months, and the patient's loving that. It feels good to them. Needs some tissue adaptation, but other than that, probably pretty good to go. So we want that bite record. We want that set to the lab. So ideally, you give us a scan the opposing, scan the bite or physical impression of the opposing, and a physical bite. And then you remove that prosthesis and put a little tray adhesive on the intaglio, reseat that, and then express some medium body between the tissue and the intaglio. And that's going to give us that adapted, the healed tissue to adapt it to the next printed try-on. Or you could scan the edentulous arch with the multi-units, and that'll also get the records that we need to adapt the next prosthesis to the tissue. So again, we need the opposing, we want the bite, and we want the prosthesis relined, whether it's digital or analog records. Send that to the lab. In the meantime, you'll take that RAPID Appliance or the duplicate appliance that the patient has that was picked up day of surgery, and you're going to send them home in that. They're not going to love the bite. You just got to get them a little bit comfortable because you've been working out the bite on the appliance you're sending to the lab. That's ideally, we take that, we're going to go to printed try-on and then final zirconia. So this is a 3-appointment process. So you're going to have the RAPID Appliance or the duplicate appliance records appointment. The next, you'll have a printed try-on. And then the 3rd appointment is your final zirconia or final restoration. So it's a very simplistic process as long as that RAPID Appliance is picked up with the patented Chrome GuidedSMILE or the duplicate appliance on some other stackable option out there. If you have that, your life is much easier to get to your final restoration. For more information, check us out in the socials, give us a call here at the lab, and we look forward to working with you on your next case.